Let me add one other thing, Congressman, all due respect. What is the difference between a brand medicine and a generic medicine? Now, you're going to tell me, and I look up, my patients come back, they got a red pill this week, and next month they got a white pill, and I wrote the same thing on the prescription. There's something wrong with that picture. And you're going to tell me, and Ms. Jones is going to tell me that I want brand, and then you put the brand, you put down the brand medicine, and they don't, the HMOs will not take care of it. HMOs are unique position to slow down the progress of health care. They slow it down. They got to argue about whether you need an x-ray or not. What are you talking about? The doctor asked for an x-ray, and you trying to cut costs. And we don't have to worry, and we don't have to say too much, except the fact that read the newspaper on where the money going. We did not have this problem until we got those so-called gatekeepers.
Right. Let me. You raised a question about Iraq, of course, and you mentioned in terms of the committee, in terms of the report that's coming out. What do we do with soldiers? I mean, we getting a lot of complaints from soldiers when they come back, you know, from the war, and a lot of them not only health problems, a lot of them have mental problems, and based on all the information I've been able to see and to find, there's not a lot of attention being paid to the mental part, which is very, very serious. So what do we do for, they go into service, they have a contract with us, we tell them that we will do this and we will do that, and then when they come back, you know, for some reason we don't remember all the things that we promised them. What can we do? I know you're general and of course colonel. I mean, and I know you've been involved with this for many, many years. I'd like to get your views on it.
Way back in about 10 years ago, when they started coming back from Iraq, all right, I mentioned the fact to my commanding general that we got problems, because when we travel around, I'd be the one to go down and talk down to G1. And they started to talk about these kind of problems. Our favorite group at the Pentagon says we don't see it. Now, one thing has happened, and I tip my hat and do the natural good salute and said, look, now you recognize what you're doing. And they're talking about the treatment. But you're absolutely correct that we have a serious problem, not only with the soldiers coming back from Iraq, but the soldiers that's here from Vietnam.
Vietnam, yeah, you mentioned, yeah.
All right?
Yeah.
Now, the thing about it, the post veterans that was involved in 9/11, nobody has talked about them, because if they went to Vietnam, they come back. And like a patient of mine said, a patient's wife said the other day, I woke up and my husband got his hand around my neck. And he was downtown in the 9/11. So you're absolutely right. We got a tremendous problem. At least the Department of Defense, I would say, has looked at it. And Colonel Kinebrew and I have been talking to people that we know in the military. And we are really, truly trying to do something about it.
What about TRICARE? Is that a solution?
Well, TRICARE, I think TRICARE grew out of the old Champers program. I think TRICARE is an attempt on the part of the Defense Department to ensure the delivery of health care and the needs, and they utilize TRICARE is administered around the country by 3 agencies. In our part of the country, HealthNet is running TRICARE, and I think on the West Coast. But anyway, there are 3 independent agencies that administer TRICARE. Well, now TRICARE is not the only health delivery system of the Department of Defense, but it is the largest. with the greatest number of mandates. In the military, we do not have a comprehensive dental plan for reservists. And I know they are now experimenting with a couple of dental programs. And the feedback that I've been getting is that it's not been good because it takes too long. If you have a toothache and you're in bad shape, you can't afford to wait for 3 weeks or a month to get them to examine your mouth and do whatever they have to do. The eyeglass program is another program that needs to be reviewed, and hopefully it's going to be reviewed. I think the HealthNet and TRICARE people are making an effort to correct some of the ills, but there were some things that are not on the table, are not visible enough on the table. And the one that you just mentioned was mental health. You know, what do you do with post-traumatic stress syndrome people? And they're coming back now, and there will be even larger numbers coming back. And the treatment for people suffering from post-traumatic stress syndrome, whether it was caused over yonder, where, as Doc would say, where the bullets are flying, or whether it was caused down at ground zero, where a lot of us were doing 9/11. It's still the stress, the element of stress. So I think there's something should be done to look into that element, and maybe some hearings or some reviews of what's going on in that arena. And there are a lot of people who would be willing to come forward and probably help form some solutions or potential solutions for these programs.
And to further go into it is to have the soldiers, and we'll have to work this out as to how they testify to what went wrong. My friend over here can be a devilish enemy because he sends me all them difficult cases. Mm. And then I have to sit down from a medical standpoint and really try to figure out what to do with them. And I get a lot of information from racial problems, Profile 3, and they're not supposed to be on that front line. And you on the front line over there in Vietnam, they take his M1 and takes the what you call them, bolts out, and don't give him no combat gear. Now you know that's enough to create problems up here. Right. So there's a whole lot of problems out there that we need to talk to the soldier.
Well, we thank God for you, Dr. Folk. I mean, no question about it.
But my numbers are small.
Yeah, thank God for you.
They need to have some more out there. Since you mentioned that, one of the biggest problems we have is the private doc. You don't want to take, like he said, he goes to places and they don't understand who's TRICARE.
We got 30 seconds, and I'm not going to let you leave without asking you this question. My good friend Charlie Rangel is in support of the draft. How do you feel about that? We've got 30 seconds.
I got a problem with it. I won't go any further against my favorite congressman. You want to talk about it?
In other words, you're against it. Okay, I assume you're against it.
You see, the problem comes up with that draft is that you promise the soldiers certain things and you don't give it to him, and you don't, and it's just a bad situation.
So we live up to our commitment that we don't have to worry about the draft. Right. All right. Let me thank both of you for being on News and Views.
Thank you.
You have been watching Political News and Views with Congressman Ed Towns of the 10th Congressional District of New York. If you have any questions or comments regarding this program, please write care of Congressman Ed Towns, U.S. Capitol, Washington, D.C. 20515, or call 202-225-5936.